Welcome to Food Safety 5, twice monthly reports from the Food Safety Magazine editorial desk to keep you abreast of top news stories and current events impacting the food safety sector. Today we're discussing new research about the rising Salmonella disease burden worldwide and the utility of whole genome sequencing for Salmonella surveillance. First, a new study by researchers from Guangdong Medical University and Yangmen Central Hospital in China found that globally, the number of invasive non-typhoidal Salmonella cases has risen by 46% since 1990, along with a 27% increase in mortality. The findings were based on global disease burden estimates for 1990 to 2021 that were derived by a network of thousands of international researchers from national and international surveillance programs, hospital and clinical data, and literature reviews. Based on the estimates, invasive non-typhoidal Salmonella cases rose from 348,244 in 1990 to 509,976 in 2021, a 46.44% increase. Mortality also rose from 48,941 deaths in 1990 to 62,018 deaths in 2021, marking a 26.72% increase. Significant regional disparities were noted. Specifically, Sub-Saharan Africa had the highest incidence and mortality rates. Interestingly, despite having a lower overall disease burden, Western Europe, especially the UK, exhibited the most substantial increase in incidence rates when adjusted for population age differences, possibly due to increased international travel, migration, and the globalization of food supply chains, contributing to the introduction and dissemination of Salmonella strains previously uncommon in these regions. While improvements in disease surveillance, reporting, and diagnostics have likely increased the number of Salmonella cases detected, the disease burden's upward trend in higher-income countries is still notable. Speaking of improved pathogen surveillance, a new Australian study has demonstrated that the use of whole genome sequencing, or WGS, has greatly reduced the national burden of non-typhoidal Salmonella infections. Part of the Australian Pathogen Genomics Program, or AusPathogen, the work was led by researchers at Australian National University in collaboration with the University of Melbourne, the University of Sydney, and Public Health and Epidemiology departments in Victoria and Queensland. The research team assessed the impact of WGS by analyzing 15 years of national surveillance data from the National Notifiable Diseases Surveillance System. Salmonella rates before and after WGS adoption were compared, controlled for factors such as state-level differences, seasonal trends, and concurrent public health interventions. Analysis of the data showed an average 11.6 to 17.5% decrease in non-typhoidal Salmonella infections, potentially attributable to WGS implementation. This reduction was most significant among the top 20 Salmonella cerevars, which account for 72% of cases, with an average effect of 26.7%. Based on these reductions, the researchers estimated that WGS likely prevents 7,200 to 10,900 cases annually, translating to $11.3 to $17 million in savings. These cost savings surpass the break-even point calculated by the researchers. The net benefit of WGS is an estimated $4.2 million. The researchers stressed these findings are important because WGS's higher cost has raised questions about whether the benefits justify the investment and, at present, the empirical evidence about its success is scarce. Overall, the researchers concluded that WGS is not only valuable for food safety and public health, but also economically viable. For more information on any of the stories mentioned in this video, be sure to check out the Food Safety Magazine coverage linked in the description. Check back twice monthly on Tuesdays for the latest Food Safety 5 episodes, available at food-safety.com or on our YouTube channel.